Greetings in the spotlight on air, and Evgenia Monakova is in the studio. We promised to continue the theme of complications after coronavirus, and this theme is quite to the point to many of our viewers. So today we have candidate of medical sciences, the head of residence of Neurologist of Amur State Medical Academy, reflexologist Vyacheslav Alexandrovich Ananenko. We have discussed this problem already, started to develop this topic, but actually we have just gone over a few symptoms. Nevertheless, we gave a huge amount of useful recommendations. Today we have an opportunity to look wider on this whole story. Let us at least approximately outline the circle of problems patients face after coronavirus. Yes, a very important component is that consequences are determined mainly by two factors, and primary factors are thrombovasculitis that occur in the acute period, plus blood circulatory disorder of organs including the nervous system. So that is why we take blood thinning medicines. Absolutely true. And of course, those deposits of immune complexes that are stored in all internal organs, including the nervous system. Well, here we have to explain what are they. Yes, this is when parts of the viruses or viruses themselves react directly with antibodies. And naturally, these immune complexes can be found in certain organs, including the nervous system. And your own immune system begins to attack its cells, tissues, which are recognized as foreign, and therefore post-delayed autoimmune disease may occur after COVID. So what do we mean when we say autoimmune diseases? Do we mean hyperthyroidisms? Is it something else? In the nervous system, it can affect the nerve itself, must soften multiple nerve damage, and almost everybody heard that it's an essential dominant polyneuropathy of Guillain-Barré syndrome. When the conducting system is destroyed, paresis occur, meaning that the person can't move. Sensitive sphere suffers slightly less, but nevertheless severe movement disorders occur. To make it easier for our viewers to understand, it's a sharp pain in different parts of the body. It could be the result of infection. Yes, and this can also be the result. It's not only related to polyneuropathy, but to mononeuropathies, such as single nerve disorder, as from the side of the facial skull, and as well as from the side of the spinal nerves. But not only peripheral nervous system suffers. Very often it is the central nervous system suffers that is responsible, we have discussed in the previous broadcast, for cognitive processes. And the autonomic nervous system is extremely often affected. I would like to make a stress here. Let us explain what it is. Yes, because the autonomic nervous system is the system that regulates the function of each organ individually as well as the system in general. And therefore, if there is a disorder in it, then there may simply arise, for instance, thermoregulatory disorders with an increase in subfebrile temperature without infectious agent after COVID. That is, it turns out, when the temperature jumps or when we sweat, this is the autonomic system. Absolutely right. Blood pressure lability, heart rate instability, and maybe even the process of disruption of the intestines, liver, and other organs. Because the main regulation is still a vegetative regulation. Let's put it in a nutshell for our viewers how long all these delayed conditions can appear. Look, there are no certain timeline for them. But immediately after discharge of patients from the hospital, those changes that have already been formed in the acute period still present. They are like residual effects, and we fight with these residual effects until we can be restored functionally. We can't always restore what is rudely destroyed, but most likely we can bring back to normal exactly these functional disorders. Therefore, we use the period as biology itself gives us, the biology of cell viability, individual for everybody. So the faster we start recovery, the better the effect is, right? Yes, of course. Let's then specify everything to patients who have faced such consequences, in what order they should act if they indeed understand they have problems with this and that, with autonomic system and everything in the world. Indeed, patients themselves will not understand, for example, if they have a pathology of the cardiovascular system or a gastrointestinal tract. What is primal? The damage of the vegetative system, which incorrectly conducts the regulation of the functions of these organs, or the damage of the internal organ itself. Therefore, of course, you first need to go to a wide-profile specialist. This is a therapist who can remotely or directly refer you to a neurologist or an endocrinologist or a traumatologist. So it is decided by a wide-profile specialist. Now, Vyacheslav Alexandrovich, this kind of SR examination conducted for such patients is suspended. But in general, there is such an opportunity, let's say after recovering from a serious illness, go through such an in-depth examination. Would it be useful? This, of course, will help. A systematic examination reveals weak links, because it's possible to treat a symptom and it's possible to treat the process itself, that is, the disease process. Moreover, the autonomic nervous system, autonomic imbalance can be emphasized by the patient himself, even on an outpatient basis. What is more, there are 6 or 7 points of great importance. The first one among them is, of course, sleep normalization. With the formation of complete cycles, 5 cycles of sleep, this builds a good base for restoration of vegetative balance. I will tell you later how to do this without medicines. The second is, of course, correct breathing, which potentiates the massage of internal organs. I will also later tell you how to do it. Aerobic loads are unconditional, of which 4 concepts must be mandatory, of which we have to pay attention to the extension and, of course, to the duration of these aerobic loads. Do you mean walking? I'll tell you later. It's very important and it has its own characteristics, and eating habits are very important as well. I'll briefly explain to you now. This is hydration, what to drink, how to drink. This is supplement of mineral vitamins. And of course, this is an emotional coherence and cognitive behavioral therapy. I'd like to stress on these things in details briefly. Well, let's start with water. Yes, as for the water regime, it is necessary to definitely exclude coffee and any alcohol beverages, including beer, from your diet. So what to drink? The best option is to use phytocidal infusions. Ginger works well, as you know. Any phytocidal form works well in the forms of viburnum, hawthorn, lemongrass, or their combinations. It is better to alternate them, that is, 1 week we take this, the next week we take that, the next week we take combination. So the quantity and amount are still determined individually. So just add them into water. Do we boil them? So just make an infusion. The best option, of course, is 80 degrees temperature, so as not to destroy those vitamin complexes that is there. For instance, we take lemon. Oh, lemon actually should not be infused. It is better to eat it with something so that there will be a result. The effect is better. So we figured out about water. Well, what is wrong with our breathing? Breathing is very important. It needs to be exercised. Let's say one of the most important elements is the abdominal way of breathing. When we take breath as if into stomach, continuing to inhale even into the small pelvis. We visualize all these, and this breathing potentiates the massage of the internal organs and very good oxygenation. So the diaphragm should move and massage the internal organs? Yes, and it is very important to do it even before going to bed. To breathe a little. Yes, with the transition to meditation. 5 to 10 minutes and your sleep will be a little different. So we moved closer to sleep. What else can we do in order to sleep well? As for sleep, it is very important not to use any gadgets an hour before the bedtime. This seems hard. The second thing is to dim the light an hour before the bedtime. Yes, let there be light, but let it be soft. Third, remove all thoughts of your future plans. How to do this? Write everything down on a paper and forget about it at night. Fourth, close all curtains so there is no any source of light, because melatonin is synthesized without light. Before falling asleep, do breathing exercises, abdominal breathing, for at least a minute. Meditation for sleep must be literally 5 to 7 minutes. If you can't fall asleep for 10 minutes, there is no need to lie in the bed. Get up, then lie down again, repeat this cycle of breathing exercises, try to fall asleep. If you cannot fall asleep, as far as I understand it is necessary to consult with specialists. Perhaps you need to include some kind of medical therapy, because sleeping is very important for recovery. Absolutely true, sleep is the main element of interoception. During sleep, the brain controls all processes that have been disturbed, and if 5 sleep cycles have not passed, there will not be restoration of internal organs in any way, even with the drug therapy. What about nutrients? Nutrients, very important components. About vitamins, vitamins of group D are invaluable. Vitamins of group B, of which pyridoxine. Vitamins of group C, of microelements. Surely, it is the use of selenium, zinc and magnesium. And all intake of all these nutrients should be under the control of a blood test. That is, everything can be controlled and we can increase the amount of only those nutrients that are needed. Uncontrollable intake leads to bad consequences, but in any case, as a rule, those who have been ill really lose exactly these vitamins to a greater extent, and doctors, when they prescribe medications, they also prescribe these vitamins along with. You know, vitamins and microelements should be prescribed by analysis results, and possibly group B vitamins, some specific one, maybe B1, B6 or B12, and perhaps there is indeed a huge deficiency of zinc or selenium, and if you drink vitamins without these microelements, there will be no result either. In general, I definitely understood that I still need to consult with doctors. Of course, we know our body very poorly, even judging by your story, I understand this. It is better to consult with professionals. Indeed, absolutely true. Vyacheslav Alexandrovich, thank you very much. As always, it was very useful. I hope everyone will be healthy and I hope we will somehow cope with this disease too. Thank you.